All right, hello. This is a video to prepare for SP patients, standardized patients. My name is Andrew Case, clinical assistant professor here at Canisius College PA program. What we want to do in this video is guide the standardized patients so they know what to look for and expect when the student comes in to perform a history and physical. Okay. So the first thing we'll start off with is, as the student enters the room, we want to make sure that the student is going through certain steps that involve the patient encounter, the first moments of the patient encounter, and setting up the interview. So the student will be expected to come in, knock on the door, introduce him or herself by addressing who they are. My name is Andrew Case. I'm here to see you and identify the patient's name. The student needs to make sure they have the correct patient name and also establish what the patient wants to be called. So if it's Mrs. Mary Jones, make sure that is identified. Date of birth can be implemented as well. And then a question to follow that says, Mrs. Mary Jones, how would you like to be called? Is it Mary or Mrs. Jones? Okay. The student should also set up the stage to be comfortable for the patient and him or herself. So establishing the right space and energy, sitting down and getting comfortable so there's as much opportunity for relaxation. Okay. So at that point, the student will be expected to ask the patient what is the reason for the visit, okay? And the patient should be able to describe and state, I am here for a new patient visit. This is my first time here. I'm here to establish a new doctor, okay? At that point, the student will ask the patient some beginning questions, and also state that there will be a series of questions that will be asked over the next 5 to 10 minutes that may seem a little bit lengthy, but since this is a comprehensive visit, there are a lot of questions involved. So the first question will be, do you have any medical problems of any sort? Okay, and the standardized patient will state, if so, state what it is. It might be diabetes, hypertension, thyroid disease, something like that. If not, the standardized patient will say, well, no, I'm just here for, again, to establish a new doctor. The student will then say, have you had any recent illnesses or any problems, any injuries of anything of the like in the last 6 months or year? The standardized patient will say no at this point, okay? The student will say, okay, I'm going to continue on to ask you questions that involve, your more in-depth history that speaks to your general health, okay? So those questions will involve, do you have, again, any type of past medical history of any medical problems? Have you had any pneumonia in the past? Do you have any things like asthma, any GI problems, anything of the sort? Just so that the standardized patient can kind of jog their memory and say, oh, perhaps I've had this in the past, and the student can take and put that in their record. Moving on from that, the student will ask the standardized patient, do you take any medications? And offer some examples. Any prescription medications, such as an antibiotic or something for a problem such as, diabetes or asthma. And then the student will ask, do you take any over-the-counter medications, any herbal supplements, any vitamins? The standardized patient will have an opportunity to answer that as well. From that point, the student will ask, do you have any allergies to medications? And the student will be expected to give an example of what an allergy is. So the standardized patient can say, oh yeah, I do react to penicillin. I break out into a rash when I take penicillin. Okay. Or if there's any other reaction to any particular medication, the standardized patient will have an opportunity to respond. From allergies, the student will ask about any hospitalizations, meaning have you been admitted for any reason to the hospital? Might be for surgery or for pneumonia or for some special procedure, okay? So what were you in the hospital for? What was the date? What was the reason? Moving from hospitalizations, any particular surgeries done electively, say with perhaps any type of elective procedure, or if there was, say, some type of trauma where it required emergency surgery. From there, the student will ask about some vaccines and immunizations. So the standardized patient will have an opportunity to talk about their childhood immunizations, if they were all completed and up to date, and any adult immunizations, say mumps, measles, rubella in college, any specific vaccines such as influenza, and obviously recently with the pandemic, COVID. Moving from immunizations, the student will ask questions that speak to social history, okay? And the standardized patients will respond to questions that pertain to what job do you do, what do you do for perhaps exercise, any things that you do that speak to substances such as alcohol. Do you drink alcohol? And what do you drink? How much do you drink? How often during the week? Do you use tobacco? Any tobacco products? Do you use any recreational drugs or any illicit drugs? Do you use cannabis for any purposes such as recreationally or for treatments? So that those questions in the social history will be housed, not just occupation, not just substances, but also lifestyle questions. What do you do to promote your health, or perhaps what things might be working against you? Do you have any sources of stress that make things quite harder for you regarding your job, your finances, your relationships, and the like? From the social history, the student will ask the standardized patient, what is your family history? Meaning, do you have any in your mother and your father, your aunts and uncles and your grandparents, does anybody have any hereditary diseases? Things that, such as perhaps a history of cancer in the family, prostate or breast cancer, colon cancer, certain diseases that can be involved with the pedigree or the family history. And if so, the standardized patient will say, yeah, my grandfather died of cancer, or my mother did, or my father did. From family history, we'll move on to review of systems questions. So the standardized patients will be given a bunch of questions from the student that will speak to each and every system, okay? And it's basically a screening series of questions, so the student will see if anything can be picked up from the patient's body systems. So those involve skin, head, eyes, ears, nose and throat, neck, questions that are pertaining to those two areas, along with questions that speak to cardiac problems, pulmonary problems, GI problems, genital urinary problems, musculoskeletal problems, vascular problems, behavioral psychiatric problems. Those are the review of systems. If something is positive in any of those questions or series of questions, the standardized patient will speak to that. Students will ask more questions about that. That will be noted in the record. After review of systems, the student will state to the patient that a physical exam will be conducted. Okay, and at that point, the student will say to the patient, "I'm gonna examine you now. The nurse already took your vitals. I noticed that your vitals don't show any problems. They're stable. Your heart rate is within normal limits. So is your blood pressure, your pulse, and your temperature." The student will also speak to general appearance of the patient and make note that the patient is looking in good health, well-kept, dressed appropriately, cooperative, and in no forms of distress, mild, moderate, or severe. From that point, the student will conduct a physical exam and inspect all the areas of the body, since this is a comprehensive exam, that are consistent with the questions of review of systems. So for instance, we''t, a head, eyes, ears, nose, throat, and neck exam. Will involve an inspection, palpation, and work way down the body that involves the neck, the cardiac system, the pulmonary system, the GI system, musculoskeletal, and any notice GU, and any psychiatric or behavioral expressions that might come from the patient. Sometimes patients may show signs of depression or anxiety or restlessness. The student should take note. The standardized patient should express if there's any problems in that area after the question. At that point, the student will review, offer a summary based on the information that is gathered from the questions from the interview and the physical exam, and make a comment about the general perception of the standardized patient's health. Standardized patient should have an opportunity to ask any questions to the student about maybe how they're doing and how they're looking, and what the impression of their overall health is to the student. The student will respond by speaking to overall health at this point, or any concerns that may have come from the history and the physical. Offer, again, a summary of general health, and then speak to any recommendations, any suggestions, any blood work or lab work that might need to be gathered that are standardized or standard blood work to get, just to check certain systems that speak to kidney and electrolytes and such. So the student will explain that to the standardized patient. The patient can also ask questions about that as to why blood work, or what is involved with the blood work. And at that moment, the student will offer the standardized patient an opportunity to speak to what could be done or should be done in order to maintain good health, or what adjustments that are made or could be made to improve health if there's any problems, such as, overweight or increased body mass index, obesity, if there's any things that are out of balance with the patient's health, and the like. And at that moment, the student will complete the exam, ask the standardized patients if there are any questions or concerns, and allow the standardized patient to respond.